Hi, my name is Chelsea Carvalho. I work for the National Management Office of the Angolan Space Program. The department I work within is Marketing and Service. The objective of this webinar is to promote the use of space technology for the benefit of the nation. Within this case, Angola, we intend to provide the context of how telemedicine has been deployed and is helping to solve problems regarding access to reference hospitals and reliable treatment by health professionals. According to the World Health Organization, telemedicine is referred as the delivery of healthcare services whose distance is a critical factor for health professionals using information and communication technologies to exchange information in real time to diagnose, treatment, prevention of diseases and injuries. However, there are many different definitions to highlight that telemedicine is an open and constantly evolving science. It incorporates new advancements in technology and responds and adapts to change in health needs and context of societies. This distinguishes telemedicine from telehealth, with the former restricted services delivered by physicians only and latter signifying services provided by health professionals in general. The aggregation of information technologies also allows for continuous research, evaluation for the education health services providers, allowing access to various health institutions of individuals in all communities regardless of the geographic location, to obtain second opinion regarding health services, diagnosis, and treatments, even though most of the intervention registered were dependent on the interpretation and analysis of images sent through the network. The concept of telemedicine brings a huge opportunity to deliver good, reliable health treatment, either for low, medium income countries or industrialized countries, most needy regions of the globe in health services and professionals. This approach enables better quality in health services and share resources. Angola in particular has conducted their first steps back in January 2014 in the implementation of Francophone Telemedicine Africa Network regarding municipal health services, with the aim to improve offers and health services. Angola recognized the importance of seeking strategic partnership to facilitate the process of implementation of telemedicine network. With that in mind, the Angolan Ministry of Health adopted a partnership with Geneva University Hospital, which more than a decade has accumulated experience and knowledge in the field through development of Francophone Telemedicine Africa Network. Another strategic partnership was developed with the Institution of Hygiene Tropical Medicine of the Lisbon New University of Portugal, a World Health Organization collaborating Center for Health Workforce Policy and Planning, with a strong expertise in healthcare services and commitment to develop health systems in Portuguese-speaking countries. In 2014, the implementation of telemedicine network began and was carried out in 6 steps: site selection, service selection, creation of national telemedicine team, site evaluation and equipment implementation, training and local coordinators and other participants, evaluation of activities. So carrying on from the implementation of how Angola saw how successful it is, I will now be showing how our illustration of architecture actually looks like. The network architecture illustrates the municipality hospitals being able to connect via video conference with both provincial central hospital and Luanda Central Hospital. The special segment in the case of Angola is either satellite AM7 or Eutelsat 3B, which are part of the compensation from Angosat 1 satellite. The satellite service provider Infrasat provides the mean of VSAT equipment for the remote locations, manages and monitor the network. The pilot project was implemented successfully in 7 total sites. 2 references are in the hospital of Luanda, the capital. One is a Medical Boa Vida. The second one is David Bernardino. These two are responsible for clinical assistance and distance education. The other 5 peripheral provinces hospitals are in Cabinda, Bengal, Lunda Sul, Malange and Pie. The expansion of the network has halted due to the financial constraints, mainly because of the international prices crude oil. So it substantially impacted on the allocation of funds of the projects such as telemedicine, such as since the requirements of the internet connectivity and power outage are critical for proper functioning of the network. In the Angolan context, as a result of the compensation of Russia on the fatal failure of the Operation Satellite and Angosat-1, which are part of the project of Angosat, a couple of social projects were implemented in the country, including the expansion of telemedicine network, which has been done in partnership between Ministry of Telecommunication and Social Communication and Ministry of Health. In the Angosat-1 satellite, the compensation Angola granted the rights to use satellites the capacities of AM7 and Eutelsat-3B satellite. So far, it permitted deployment of 32 telemedicine sites connected via satellite link, spread in 4 provinces in the country, namely Luanda, Huambo, Lunda Sul and Mochico. One of the challenges were low level of computer literacy among participants in peripheral sites, such as insufficient computer skills and lack of technology readiness. These were identified as major factors associated with failure of e-health projects. Therefore, efforts are being made by telemedicine team to organize regular meetings to familiarize with tools of telemedicine. A possible solution that was suggested was to introduce telemedicine training into medical students' education and nurse training, with students exposed to its routine use. This will help facilitate the appropriation of the technology into daily activity. However, another barrier identified came from a couple of senior physicians and experts who showed lack of motivation and interest and were afraid that telemedicine tools implied additional workload. During the COVID-19 pandemic, telemedicine infrastructure in Angola has been used to train health technicians and guarantee primary health services in municipal hospitals, avoiding affluence of people in reference hospitals. In fact, the overall plan is to extend telemedicine network throughout the country while improving the means of internet connectivity over satellite. Thank you for your invitation and time granted to us. We are very delighted to participate in this webinar to disseminate our activities related to space and share our experiences on how space application has been used indeed to benefit our nation. Thanks for watching.